Hi, this is Robert Crandall with Pinellas County, and I want to talk to you a little bit about stroke documentation. Up until this point, we have been using this stroke destination tool worksheet for determining which type of destination to take your stroke patients to. However, we have found a better way to do this documentation that doesn't require double documenting everything, so we will be getting rid of this worksheet in July. So the new section of the form where stroke documentation will take place is this stroke tool in your assessment section of the form. Now, if you look at the order of how things are documented in this form, you'll notice that they follow very closely with the BLS section of M4 in the Medical Operations Manual. This is very much on purpose. So your first item on this list is to determine and to document your time interval, right up here on top. So you have two time intervals that you're looking for. You're looking for the exact date and time of the symptom onset or discovery. And you can always use these times. So, 2, 3 hours ago, you can just hit your hour buttons here. Similarly, your last known normal time, whenever the patient was last known to be normal. There are a number of supplemental questions that will help in the process of determining which type of destination to take stroke patients to. First here is your worst symptoms present upon waking from sleep, yes, no. And then what is your last known normal time here, greater than 3.5 hours ago. Now, the next thing you want to do, according to Mom's manual, is do your fast ED stroke exam. Now, if you notice there are two vitals already present here, it's because the stroke exam lives inside of the vital section of the form. So if you have taken any vitals, they will appear here. However, if you just hit this add button, you'll pop up with a fast ED. So you'll just document this how you normally would. And then when you're in this section of the form documenting your results from your assessment, you'll see that this stroke numeric score down here will automatically fill in. So this is just the numeric portion of the fast ED. There is also this stroke scale score response. This will be your judgment call on the scene based on what is baseline for the patient of whether this is a positive or negative stroke result here. And you can ignore this blood pressure stuff. This will probably be cleaned up before you get to the form. Now, after you've done your fast ED, next step here would be to declare an alert. And we've put the criteria for calling an alert here just as a reminder, and then you'll just have a real quick, easy way to just add a stroke alert. Stroke alert's already pre-selected, and it'll just need a time when it was called. Now, central to this process, as well as central to the form here, is getting a phone number for the witness of the event. This is a very key, important data point for you to be collecting on scene. This is information that is needed by the hospital so that their doctors can call anyone who was present when this stroke came on to help them to treat the patient in the best way possible. So you'll just get a here, Bob's friend number, and then whatever information we put in, just non-relative. So we have that name and phone number for the hospital to contact that person to help them treat the patient. The last section of the form here are all of your complex stroke upgrade criteria. So if you're trying to decide whether to take this patient to a primary or comprehensive stroke center, these questions here are to help you determine what would be the best place for them to go. Your first question here is that fast ED score that you took up above. Then there is, do you have a suspected intracranial hemorrhage? And then this medical surgical history, you can document any of the patient's history here. However, if you already documented it, or if you pulled in the repeat patient information for the patient prior to coming into this part of the form, it will appear here already. Then there's just a couple of yes, no, unknown questions in case you're not able to get patient history for whatever reason about the different criteria uh, that are laid out in the mom's manual. So we'll just answer those. Medications, same idea. If you've already documented these or if they were pulled in from the repeat patient database, then they'll already appear here and we'll help you to answer this anticoagulants question. Aspirin, anything other than aspirin is part of your comprehensive complex stroke upgrade criteria. So your last question is similar to the last question in that worksheet of, okay, are you taking this patient to a primary or comprehensive stroke center? If you answer primary here and based on your responses above, that doesn't seem to be correct, there is a yellow flag. This will not prevent you from submitting this report. This is simply here as a reminder to say, hey, based on what was above, it looks like you should be taking them to a comprehensive center, but we don't want to enforce any sort of clinical decision making just on flags in the form. So you can answer this either way based on which way you'll be going. Happy to hear any feedback that you have about the form or anything else that we can help to make your lives better out there in the field, and hope to stay safe.